This is 12 on Health with Gillian Neff.
Welcome back to 12 on Health. Fear of the dentist chair keeps many people from getting the dental treatment they need until it's too late. And if you've ever put off a dental visit, you know too late can mean an excruciating toothache. Dr. Jerry Simon is here to tell us of an alternative for such people. He practices sleep dentistry at his dental practice in Stamford. Sounds like a great idea for these folks if they can get themselves to the dentist.
Well, you know, the problem is that most people don't relish the thought of a trip to the dentist. Some people feel a little anxious. So for those people, we have the stereo headphones, the TV in the dental treatment room. They can watch their favorite show, paraffin treatment for their hands, and all those niceties. But some people are very, very anxious, and those people just have this primitive reflex. They just don't want to go to the dentist.
It's like a fear of flying or any other fear.
Yeah, it's like any fear. And what happens is intellectually, they know they really should go.
Right.
But when they go to pick up the phone or drive into the driveway, the little voice inside says, no, stop.
Gosh, that makes me think you must get a lot of cancellations, at least until now, before you offered such things as sleep dentistry.
Well, some people are just very fearful, and the dental profession actually has pioneered comfort aids such as general anesthesia. The first person who had a general anesthetic was administered by a dentist in the 1800s, actually.
You're kidding me.
And dentists have invented the disposable needle that we take for granted today.
That's interesting.
So we've been at the forefront of trying to deal with pain, and now we have an even better solution.
How does sleep dentistry work?
It works great.
Well, it works great. Oh, I'm glad to hear that. But it starts with an oral medication?
What the patient does is, after their examination, they decide what they want to have done, which is very easy because there's no work done that day. They get some pills to take home with them, and they take 2 little pills in the morning, an hour before their visit. And someone drives them to the office, and they come in kind of groggy, sleepy. And then they would sit down in the dental chair. We would put the monitor on so we can check their blood pressure and their pulse. It's all very, very safe. And then we'd give them some additional medicine, all oral, no injections. And they just drift off into a kind of a semi-sleep where they're kind of part sleeping, part awake, and they have no memory of being at the dentist. It's wonderful.
Are there any concerns involved? I know some people, when they sleep, have trouble breathing, for example.
Well, when you're lying back and you're lying in a position like that in a dental chair, it opens the airway. And it's done on healthy people. If someone has, and it's for adults, if someone is over 18 and they're basically healthy, then this is perfectly safe for them.
Tell us of a couple of examples of your patients who perhaps put off dental work and now have found this to be a solution for them.
Well, one lady, her name is Marina, was very, very fearful of the dentist. Her story is that when she was a child, her parents made her go to the dentist. Her mother made her go. And her mother also didn't believe in local anesthetic or getting numb. So she would just suffer through these visits, and she hated it, and she's very, very fearful.
She went without anything?
As a child. So you can imagine these memories. And it got to the point where not only did she not want to go to the dentist, she didn't even want to bring her child, because just physically being in a dental office was awful.
She had developed her fear. And another example, a root canal patient?
Well, a lot of people think of root canal as the worst thing I could possibly imagine. But actually, with modern techniques, root canal, it really isn't so bad. It really isn't. With good local anesthetic, you don't really feel anything anyway. But again, those fearful people. So we'll have a patient, for example, who will come to our office. They might come at 8 o'clock in the morning, and they would have some cavities fixed, some fillings. They might have some gum work. They would have, because we have all the specialists in our office, so the patient can stay in one place, and the periodontist can come in and do the gum work, and they leave. The patient stays there sleeping. Then the root canal dentist comes.
Get it all done.
Patient stays sleeping. Yeah, the hygienist comes. You know, I put some veneers on their teeth or treat them. And at the end of the visit, we just sit them up and wake them up, arouse them, give them a little fruit juice to drink, and they just walk out.
One last question for you. If somebody comes for sleep dentistry, it works for them, do they then need sleep dentistry from there on, or do you try to kind of wean them off of it?
That's a great question. The majority of our sleep dentistry patients, once they've gotten over this initial hump, because remember, if they're very fearful and they put it off, they could need a lot of dental work. So they're going to be reluctant to go to the dentist. So now they let this build up and it becomes a big, big thing. So not only are they fearful that it's going to hurt, but they now intellectually realize that they're in trouble too.
We get them over the hump.
Once we get them over that hump, often they can come back for routine care without needing the sleep dentistry.
That sounds like a success. Thank you so much, Dr. Jerry Simon, and you can find him at Dental Care in Stamford.